say this is this form of therapy works?
Well, I think that we have a natural bond with animals, and I think dogs are pretty much a natural as far as connecting with people. And I think that they, see, they make people smile. They make people come out of their shells. Just very natural. There's no judgment. It's a very calm, usually. She's a little on the hyper side right now, but it's usually a very calm interaction. And I think it makes people come out of themselves, not focus on their own problems, their own things, bring some joy to their day.
All right. So you've seen it personally help people.
Oh, absolutely. No question about it.
Has it affected your feelings watching the animals work towards like animals in general?
It has, to the extent that I think it's amazed me at their innate ability to connect with people. I mean, I think I knew it on a certain level, but to see it on the level that I could come to see it during pet therapy has been quite amazing. They're very intuitive, and they can cut right through problems that people have, and I can't do that. Human beings can't do that. I see the patients doing their physical therapy or their OT work with pleasure, and yet when they see the OT or the PT person come into the room, everything changes because the dogs really motivate them and make it fun. So I see that innate ability they have.
So it definitely makes your feelings a lot better. So if so, how do you feel after you watch the dog interact with the patients? Or
Me personally?
yeah.
Oh gosh, usually there's a wide range of emotions. Certainly I can feel relaxed as everyone else around can be. Often I'm quite amazed by some of the things that they accomplish. I'm very gratified. I'm kind of humbled because I know I can't reach some of these folks and my dogs do. So it's just something they have that we don't. So, I mean, I could go on and on about that.
Okay. What type of therapy animals have you seen?
Well, dogs are traditional, yes, but I've watched, we have a credentialed mini horse in our organization just recently, which has been phenomenal. We have had some really lovely cats. Bunnies are awesome if they have the right temperament for it. And we actually have had a duck in our organization. But I think one of the most amazing things was when I was a student, watching a woman do pet therapy with an African tortoise. And she plunked this big tortoise down in the middle of the table, big long conference table. And I didn't think a tortoise would really interact with people. I didn't know much about them. But he was absolutely gorgeous, and he went up and down the table and interacted with each person, eyeball to eyeball, all the way around, as we fed him pieces of lettuce and pieces of carrot. And he was very interesting, and it was just a unique experience. So that was probably for me, the most unique one.
I like that. That's really cool. Which, in your opinion, I know this is a hard question, probably to answer. What do you think is the best therapy animal?
I don't think there's one species that I would call the best, but what I would say overall best is their temperament and their desire. Do they have, that's the question we always ask. Do they have the desire to do this work? Do they like people? Do they find joy in it themselves? And that's what's most important. I think that's the big question no matter what the species.
So could a fish be a therapy animal? Or like reptiles? Do you think that could work?
I mean, I refer to the tortoise, and I don't know a lot about tortoises and how they display feeling, but he certainly displayed interest. We actually, the gentleman that you just saw for a minute here, actually interacts through the glass with the big goldfish in the next room. And the goldfish certainly is interested in him. And I know that this gentleman totally enjoys the interaction, so I think that's pretty neat. But I don't see why, as long as whatever the pet is, as long as it was safe, and that's the other key, interactions have to be safe. As long as it was safe and enjoying it, I don't see why it couldn't be done successfully. You're warm, aren't you?
What would you say, in your definition, is a therapy animal to you?
Well, I have to go back to what we believe is part of our mission and our philosophy, and that is a pet that enjoys, an animal or a pet that enjoys the interaction with people. Obviously, if they're frightened or they're afraid, it's not ethical and it's not beneficial to anyone.
Yeah.
So a therapy pet, I think, has to be someone who enjoys what they're doing, and therefore it becomes effective. And it has to be a two-way street, not just the client, the pet needs to benefit. Right, Glenn?
What are, is it easy to train and certify the animal? Or is it a long process?
No, not really. Because again, it goes back to our philosophy. We aren't looking for the best trained animals. We're looking for pets that have great personalities and great temperaments. And everything else can come from it, from there. We usually suggest, when you're talking specifically about dogs, that the students might consider having at least obedience 1 under their belts, the basic sit-down stays. But we can work on those things. It's not, imperative that they have it. But what is imperative is that the pet enjoys what they're doing and has great temperament.
Okay. What are the benefits, do you think, from pet assisted therapy?
To clients?
Yes, to the clients.
Well, it's been documented that blood pressure lowers. It's been documented that the effects of depression decrease. At Fatima Hospital, for example, it was documented by the staff there that after our visits, the patients were actually asking for less medication following our visits, and it would go on for days, which was also very interesting, so it had an extended effect. I think there's no question it brings joy to their day, and you'll get to see that here today, there's no question about that. I think it brings a welcomed change to the routine of being hospitalized in a facility, and a routine in that way. I also know that it helps with the physical therapy and the occupational therapy work that we were talking about earlier. They get to achieve some of the goals that they need to.
All right. Does it help patients become more social?
Oh, yes. Yeah, absolutely. Saw that a lot at Fatima Hospital. I worked on the Jerry psych and the adult psych unit with my dogs, and we had a lot of people that were to themselves and not really wanting to be part of the group. But when the dogs came into the room, it really changed things and made them much more want to become part of the group and be social. And I see that with children. A lot of the children that I see in the classrooms are by themselves, but once we come into the room, they want to become part of the group. And I think it changes the whole atmosphere.
Would you recommend to this type of therapy for somebody that had PTSD?
Yes, absolutely. In fact, we have some members in our organization who have their own therapy dogs and also now getting their dogs certified so that they can go out and give back, especially to a lot of the returning military that have the same issue. They find it's very, very beneficial. It's very calming, very soothing, helps them sometimes get out some emotions. The dogs just seem to connect on such a personal level that I think these folks need it.
Could it replace human interaction therapy, do you think?
Replace? That's a tough question for me to answer. I don't know about replace, but I certainly know that I have seen patients that benefit by pet-assisted therapy more than human interaction because they don't want human interaction,
Yeah.
but they definitely welcome the pets. So I don't think you can replace human interaction, but I think pet interaction is often more welcomed, is the way I would put it.
So I know you already answered this kind of, but is it just as good or better than medication, do you think, in these patients' eyes?
I guess again, it would depend on what kind of medication you might be speaking of, but we did document that at Fatima Hospital, less was required after, and this was in a psych unit, less medication was required after pet therapy that extended on for 2 or 3 and sometimes 4 days. So it's part of the whole therapy process and package that the patient goes through. And I think it's wonderful to know that less medication is needed. I think that's terrific. I think they become very dependent on it. So, can it eliminate it? That would be wonderful to know if we could do that someday, but I'm not sure about that.
Okay, this is the last question. Would you recommend it to all people, even if they don't have an issue, a mental disability, anything?
Mm-hmm. Absolutely. I mean, I just know that, you know, they're my own personal therapy dogs at home, to be quite honest. And anyone who's ever had a close relationship with a pet at home, whether it was when they were a child or an adult, just knows the benefits. I mean, what's better than coming home from a hard day at work and having your best friend meet you at the door, you know, like you are the best thing on earth. There's nothing that can replace that. And so if it does that for us at home, it only makes sense it would do that for these folks. And so I would recommend it to try it for anyone. We've even had clients with, that have been afraid of pets, afraid of dogs in particular, slowly begin to learn that dogs are okay and want to be part of the program. So I would recommend it for absolutely anybody in any situation in life. Give it a try.
Thank you very much.
Oh, my pleasure.
We're all good.